often do you have your medical checks? Yearly, rarely, once in 3 years? Today on Soundhealth, our focus is on raising the awareness level on routine medical checkup to beat the rising statistics of non-communicable diseases. I'm Olasumbo Modupe. Welcome to Soundhealth. On innovation this week, researchers showcase the use of microbiome to diagnose, treat, and prevent diseases. That's in a moment. The program continues in a bit.
I'm not really making use of hospital like that, because if I say that I'm going to hospital, it's a lie. I can tell you that almost since 2008 is the last time that I attended hospital.
I do a routine check every 6 months, and that includes my teeth. Okay. What do I do? I do my blood pressure every day, every 2 days, and so on and so forth. I do blood tests every 6 months. Sometimes I forget 3 months, but I do it before 6 months.
I've been going for what they call blood pressure, diabetic checkups and whatnot, but I've never had the opportunity of going for prostate screening.
I used to advise people that it's necessary to take it regularly, because the way the thing is happening now is so bad. Like day before yesterday, day before yesterday, one man woke up in the morning, went to the distance to buy newspaper, and went back inside. Before 30 minutes, they rushed him to the hospital and he died.
Well, Bode and other members of the public are not the only ones guilty of that. I am also guilty. I hardly go to the hospital. I have a phobia for hospital. And it's as if I don't look after myself. But as Nigerians, we only like to visit the hospital when we are sick. And today on the program, we are looking at routine medical checkup. How often do you see your doctor? I have today with me on Soundhealth a family practice expert. He's Dr. Abiola Ajayi. He's also the ND and Chief Executive Officer of ROA Hospital. Welcome to the program, Doctor.
Thank you for having me.
It's so good to have you on the show. Dr. Ajayi will be speaking on behalf of Hope Health Mission and the hospital. The hospital has put together a free health mission for Nigerians. To start with, how often should one see a doctor? Because in this part of the world, we hardly do that.
Routine checkups typically are yearly. At least once a year, one should see a physician. That's regardless you're having any issue or not. At those routine visits, the doctor should now plan those checkups that you may need, whether it's eye checkup, dental checkup, prostate checkup, so at least once a year.
I understand the hospital has put together a free health mission just to encourage Nigerians to adopt free health services, to adopt routine medical checkup. Why did you put this together, and how long have you been doing this?
Well, what we intend again is increasing awareness. Our number one problem in Nigeria is ignorance. And what we typically do is wait until we have a problem before we seek help. Typically by then, it's very difficult for us as medical practitioners to solve the problem. If we can focus on preventing something before it happens, we'll be able to reduce a lot of senseless deaths and sickness in the country.
These you've seen, I'm sure you must have evaluated them. What are the most featured health cases so far?
We see a lot. we will see high blood pressure. Of course, you see that very often as a medical case. It's the most common. And it's the reason why they call it the silent killer, because typically people that do not do routine checkups, by the time you know you have high blood pressure, pounding headache, heart attack, or stroke, it's oftentimes too late. So we see that very common. But also we do a lot of surgical missions. So we'll see prostate-related diseases, prostate cancer, and prostate disease very often. See hernias a lot, which are swellings in different areas of the body, and of course we see fibroids. Those are our top 3 cases.
According to a recent global health report, where we are today, we were actually there 20 years ago when it comes to communicable diseases. We now have rising cases of non-communicable diseases like cancer, kidney failure, heart failure, and the likes. How did we get here?
As we live longer as human beings, and as we become more industrialized as a country in Nigeria, you'll start seeing more and more of these diseases. For example, now, if back, let's say 100 years ago, when the average lifespan was maybe 20 years less, it's typically infectious disease that would take someone's life. Cholera, malaria, something of that nature. And people didn't live to become 70, 80, and 90 years old. But now that we're living older, now you start seeing chronic diseases, you start seeing cancers, because typically it takes longer for those to appear. For example, now prostate cancer is very rare in somebody under the age of 40, but by the time someone is of an advanced age, 1 in 6 men will have prostate cancer. So that is because of our nation. As we're advancing, we'll start seeing more and more of these diseases.
Can they be associated with lifestyle adopted by members of the public?
Definitely. As we're eating different types of foods, as we're eating foods higher in saturated fats, we're eating processed foods, I won't name names, but our different retail chicken outlets and other fast foods. And as well as we bring in different technologies that are bombarding us with different radio frequencies and ultraviolet rays, all of these can increase some of these diseases, especially cancers.
As there is a shift in focus from infectious diseases to non-communicable diseases, experts believe policy adjustment, reformed health system, effective partnerships will be key to reorienting systems to treat this kind of diseases. What's your take on that?
Well, a lot of politicians to make those decisions. From a medical standpoint, increasing awareness is what we really need to focus on. Getting the word out that it's not taboo. There's nothing wrong with going to see the doctor and just getting a checkup. There's nothing wrong with going to get your blood pressure checked. Typically, we have a feeling that if you don't know the problem is there, the problem doesn't exist. But to be truthful, that's not the case.
In many countries, tertiary hospitals are overwhelmed, they are overburdened. We now have cases where people don't even visit the primary health center, not just because they are underfunded, not just because they are under-equipped. People just believe the primary healthcare centers or facilities cannot attend to cases presented at the secondary or tertiary hospitals. How do we move from here?
I think a lot of the energy and some of the resources of government and of private organizations, I'll keep repeating, increasing awareness is what we need, so that some people can have more confidence in some of these primary centers. Like you mentioned, tertiary centers are overburdened. So some of these primary health centers that are out in the villages and even in the urban areas, people need to have confidence in them and even know that they're available. So we need to spend more resources on getting the word out that yes, you can go and get a checkup here, you can go here if you have any kind of issue.
Okay. Doctor, this death has made the public to shift from public health hospitals to private healthcare providers. But it's so unfortunate that some private healthcare providers are not living up to standards.
Well, I'm coming from a country where there's maybe sometimes too much regulation, but having some standards. First of all, we need to come together and have some standards in place. For you to call yourself a private hospital, there needs to be a set of guidelines and a set of regulations that are followed. And then we need an organization, maybe a governmental body that will help to make.
Well, we have one in Lagos. We have the Health Facility Monitoring and Management Agency. That's the pharma.
I've heard of them. I've heard of all of them. We've registered with all of these different organizations, but I don't want to take. Oftentimes, they may not have the resources needed to do their jobs effectively and to monitor effectively, and they may not be taken seriously at times. So that's where a lot of our energy needs to be.
Looking at the National Health Insurance Scheme, the platform was created or initiated by the federal government, but it's so unfortunate now there's a role in that sector. The head of affairs there has just been suspended. Before that time, members of the public hardly subscribed to that scheme. How do you think we can achieve a vibrant health insurance scheme?
The key word you mentioned at the beginning of your question was developing. We're still a developing country. And the countries we're comparing ourselves against, let's say US, UK, their health insurance or their health schemes have been in place for hundreds, some of them hundreds of years, some of them decades. So we can't compare ourselves one-on-one to those countries. If we have persistent and consistent effort, we'll get there. I'm not happy that a man was suspended, but I'm happy that we identified a problem and took the correct steps. If we continue like that, Nigeria will improve.
Okay, with your years of practice, what do you think we are lacking when it comes to the NHIS scheme?
I would say management. I would say we need more directed management, and then also enrollment. A lot of people don't know that they are eligible. A lot of people don't know how to even enroll in the national insurance scheme. Okay. So we need some effort in preparing people's minds, getting them ready for enrollment, and maybe electronics, allowing people to register online, making it easily accessible, and doing some tutorials. We'll go a long way.
Okay.
Do you partner with these HMOs, the health management bureau?
I don't know if I should say fortunately or unfortunately, but yes, we do partner with them. At times, the interactions are frustrating. I'm sure they are facing issues, the same issues all of us are facing in the country, that are obstacles to performing their job effectively. But it's still the right direction to go, meaning having health maintenance organizations, having health insurance is still the proper way. We're just not there yet.
Okay, so what has been your working relationship with the HMOs and all of that?
Some of them are quite good. Some of them try to direct your medical practice based on financial gains. Let me put it that way. For example, some of them will tell you which tests you can run, which tests you cannot run out of primary. Typically, let me say ignorance, not knowing that the way to make money is not by restricting the doctor's ability to do some needed diagnostic tests, because like we mentioned earlier, prevention, you'll spend, there's a research that shows that if you spend $1, or say 1 naira now, you can save $10 or 10 naira later. So if you allow us to focus on some of these diagnostic tests, you'll end up avoiding some surgeries, some costly drugs, some other things down the line.
So what makes your hospital different from other private healthcare providers?
Well, all of us in the private sector are trying. We have a chairman that's practicing in the US. We have an MD that's been abroad. So we've seen how things are done and try to be relentless in maintaining the standard. We're still employing, we employ all Nigerians, we're still all Nigerians, but just trying to be consistent in maintaining a standard and not accepting anything less is our only difference.
What are your final thoughts on achieving a vibrant healthcare system in the country?
We're improving, and let's not lose hope. Let's not lose confidence. We all should support one another. The call I would make is that those of us in the private sector, instead of trying to compete with each other, we should learn to collaborate with each other, and we'll see Nigeria move ahead.
And to Nigerians, what is your advice to members of the public when it comes to routine medical checkup?
I have someone in my family that says, if you don't cry today, you'll cry tomorrow. So try and see your doctor on time. If you have any ailment, instead of running to a dispensary and just trying to self-medicate, try and see a competent physician first to get some direction. Usually it will save you heartache further down the line.
All right, so thank you so much, Doctor, for sharing your expertise with us on Soundhealth.
It's my pleasure. Thank you.
All right, that was Dr. Abiola Ajayi, a family practice expert and MD CEO of Arohe Hospital, on adopting routine medical checkup to beat diseases in the country, especially rising cases of non-communicable diseases in the country. Soundhealth continues with trending issues in the health sector and home essentials. Please stay with us. The program continues in a moment.
Okay, it's still Soundhealth on Lagos Television. On Innovation this week, we showcase experts' use of microbiome to diagnose, treat, and prevent diseases. That's in a moment. Please stay with us. The program continues in a bit.
the microbiome to prevent, diagnose, and treat disease.
Our microbes have a mind of their own. They play a big role in health and disease, and the trillions of bacteria making up communities in our body are called the microbiome. Chemicals emitted interfere with the way food is digested, medicine is deployed, and how a disease, like heart disease, metabolic disorders, or even cancer, progresses. Discoveries are being made on potential of the microbiome to develop new diagnostics that can detect relevant microbe imbalances, that can create new therapies to correct imbalances, and can advance new probiotic products to prevent dangerous imbalances. A newly created National Microbiome Initiative will invest $121 million from federal agencies and another $400 million from outside sources to accelerate research and development and make the microbiome healthcare.
This is where we say thank you on today's edition. Hope you've learned a few things. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.